The month of June is Men's Mental Health Month, and surveys show that women are diagnosed more than men with mental health conditions such as depression and anxiety, while men don't speak out about their feelings until it is too late. Well, according to the South African Society of Psychiatrists, men underplay the distress caused by these symptoms, drowning their depression and anxiety with poor coping behaviours, increasing their risk of the anxiety or depression to go unrecognised and untreated. Now, to combat this, I Dove Men+Care has created platforms for men to be able to share, to discuss their experiences and help educate each other through their different experiences. Now, this is to help other men out there to show care to themselves. To tell us more now, we're joined via Zoom by clinical psychologist and spiritualist and healer Anele Siswana. Anele, very good morning. Thank you so much for joining us. Welcome to Morning Live.
Good morning to you, my brother. Can you see me?
Yes, I can hear you and see you. We're good to go. First of all, consistent evidence worldwide has found that, men are less likely to go seek for mental help, despite what? Age, background, or racial or ethnic background. So what are some of the mental health issues and disorders that are currently affecting men?
There's a general scope of common disorders, which I think men are not entirely mutually exclusive in experiencing that, and we talk of substance abuse-related and addictive disorders. We're talking of major depressive disorder. We are talking of anxiety. We are talking of post-traumatic stress disorder. But any kind of psychological or psychiatric diagnosis comes with certain narratives and stereotypes, which is what contributes potentially to some of these stereotypes that men avoid seeking psychological services and psychiatric services where needed. So those are some of the contributing factors, but generally the common disorders that I've explained, those are the common ones.
You know, Anele, as a man, you and I, we know that if a man tries to express his own vulnerabilities, there's that fear of being branded as as a weakling, as a sissy boy, as feeble, which is so unfortunate. So how can men treat these mental health disorders without, of course, undergoing, such disorders?
I think we need to first demystify some of the problematic knowledges that exist about psychiatric conditions and mental health generally. So if men can encourage each other to find safe spaces that will then hold space for that vulnerability, that instead of going to men's spaces and talk about everything and general things, and maybe mental health seems to be one of the things that need to be on the agenda so that we can capacitate men with the appropriate language and appropriate vocabulary that will then help them demystify these stereotypes and misconceptions, and mostly deconstruct the stigma that then comes with having to live with mental illness or any form of mental health-related problem.
When you talk of safe spaces or the creation of safe spaces, what is it that you're referring to? I mean, do you believe African, in particular black communities, need to do more in creating these safe spaces to discuss mental health issues?
Yeah, certainly. There is a great need for that in our particularly black communities. And it goes back to what I spoke about, having a language capital and vocabulary of normalizing these illnesses as probably speaking, rather than speaking of mental illness, probably speak of mental health as a general problem. So I think in these spaces then we can then talk of mental health and how we can then capacitate men with what is it that we're going to talk about when we talk of mental health.
How would you suggest men have conversations around mental health with family and friends? I mean, how important do you think these are to have?
These are very important to have because in families, that's where support often comes from. So if we can then work with families, if we can then start then talking about mental health in our families, it is then possibly where people will be supported. This is where people will be reminded of being compliant with their treatment. This is where people will be reminded of going for psychotherapy where it's needed for them to attend psychotherapy-related services.
Yeah.
So for me, in our communities, the key thing is stigma around the narratives centered on mental health. So we need to demystify those narratives. We need to reconfigure how then in our families we can think of supporting someone who is struggling with mental health-related problems.
Just a quick one, Anele. Often when mental health interventions are made, they are made reactively. And many of us only address our mental health issues when a mental health crisis befalls us or maybe someone prominent takes their life. And it seems we don't actually see the need to address our mental health unless symptoms are evident. So what do you make of this, and what would you suggest being a general attitude towards mental health?
I think it is through initiatives and campaigns like Dove Men+Care that we are trying to find possible ways of undoing these problems that exist. But mostly, the most powerful form of intervention that is very important is primary intervention. And primary intervention has to do with teaching the most fundamental basics of mental health, like what we're doing with Dove Men+Care, and making sure that we have experts like me who do have the knowledge and understanding and that have worked in certain contexts with a clear understanding of how these realities of mental health work. But for an integrated response, it has to be holistic. Not only rely on psychiatrists and doctors and psychologists, and use local resources of organizations, and also making sure that people are aware of places like SEDAC, Lifeline, that they can assist in towards this integrated approach of healing far beyond than just treatment of the actual illness itself.
And we certainly hope that this will signal and herald a start of, the breaking of these cultural barriers to addressing mental health issues, especially amongst men. Thank you so much for joining us.
Thank you so much, my brother.
Thank you. Well, that was clinical psychologist and spiritualist healer Anele Siswana speaking to us about a platform created by Dove Men+Care that they have created for men to discuss, to share their experiences and help educate each other through their different experiences. This is to help other men out there to show care to themselves.